I mean, engagement's really important for us as a CCG, and I think we started in a good place because in the days of practice-based commissioning we were quite several smaller groups, and we just knew that we had to come together to work to be more effective. So it was really that bottom-up agreement that we needed to come together that was really important, and it was clinically led. So we've come to a place now where we're one CCG across North Tyneside, and that really feels the right size for us to be, and it's a balance between being fairly big, but big enough to make a difference, but not too big that people don't feel an identity in the group.
So early on, one of the things we did was spend a bit of time thinking about how could we develop an easy, accessible toolkit based on evidence base that would be readily accessible, that could be used in practices. And we wanted to work with the practices to engage with them very early on something that was really important to them. And I think that's probably been the reason it's been so successful with the practices. We're involved in well established in more than 16 practices now. And it was important to get them to think about what was important to them, what was affecting their daily working lives, where they could look at and applying improvement methodologies in a different way. As part of that, one of the conditions, because it is about a partnership, it is about that sharing knowledge between us and them, and obviously us listening very carefully in terms of what their challenges were, because we don't work in the practices on a daily basis. And as part of that, it was them signing up to a compact, if you like, in relation to making sure that all of the staff had the opportunity to have awareness raising and have initial education session. And that way it meant that all of the staff heard the same thing at the same time, but they were all engaged early on. And I think that's sort of been a really good way to go forward, because it's meant that as well as GPs, we've had some very, very active GPs, but we've also had very active admin, staff and practice managers. And the recognition that it takes everybody to do their part to make something work well has been important.